Hello, amazing viewers. My name is Lucy, and if today is the first time of seeing my face, welcome to my channel. Today, I would want us to discuss something that is very, very important. The reason I want to talk on this is because in the recent deliveries I had, up to 3 women are delivered, gave birth to dead baby. And I want to tell you that there are some things you need to do as a mother in order to prevent about 70% of these of delivering a dead baby. It is called intrauterine fetal death or stillbirth. I know as a mother, no one will be so happy to have a dead baby at the end of 9 months journey. Some do happen even before 9 months. When you carry a pregnancy up to 20 weeks gestation and that baby stop living, it is known as intrauterine fetal death or stillbirth. You as a mother have a part to play in order to prevent some of these deaths that occurs inside the uterus. One is making sure that you check your blood pressure. If you are having high blood pressure or preeclampsia or eclampsia, it's going to affect your baby, thereby reducing the amount of oxygen and even the nutrient the baby is receiving. When this occurs in the uterus, it can lead to intrauterine fetal death. Then, if you as a mother have any type of infection, be it malaria, syphilis, HIV, hepatitis, some of these infections will cause the placental barrier and get to the baby. So make sure when you are pregnant that you treat all the infections you had before taking in. And when you took in, continue taking your drugs so as to minimize the chances of it being transferred to your baby. Another thing that can also affect the baby in the uterus is when the mother is having diabetes, especially the ones that are not controlled. It can affect the baby in the uterus. Or if you as a mother had an accident or physical trauma of any type, it can also affect the baby in the uterus. So all these intrauterine fetal death can be prevented when you are able to detect it on time. That is the key. Being able to notice when it occurs and the things that might lead to that, then preventing it can reduce the rate of fetal death. Then, as a mother, make sure that you observe your baby's movements. When the baby is in the uterus, it is only through the movement they can actually dictate if everything is normal. Sometimes when there's reduced movement of the baby in the uterus, it points to some dangers. When it occurs, always ensure that you visit your healthcare provider in order to determine the state of your baby. Another thing that can affect the baby that concerns the mother is, please make sure that you register your antenatal on time, because through your antenatal there are some tests that are going to be carried out, especially your blood level. If your blood level is very low, you will have anemia, and when there's reduced blood supply during pregnancy, it can affect the baby because both the oxygen the baby is receiving and the nutrients will not be getting to the baby as it's supposed to, and this affects the baby in the uterus. Then there's also a part that the placenta plays when it comes to intrauterine fetal death. If there is placenta insufficiency, what is placenta insufficiency? By right, it is the work of the placenta to provide the baby with both the nutrients and oxygen the baby receives. There are some placenta that will stop working even without anything happening. So if the placenta is not able to provide all the nutrients, the amount of nutrient and oxygen the baby needs, this can cause intrauterine fetal death. Then, if there is placenta abruptio, and this is when the placenta separates in the uterus, by right, after delivery of your baby, the placenta separates before it can be delivered. But when this separation happens in the uterus, even without delivering that child, the baby might die in the womb. In short, 90% of placenta abruptio always results to intrauterine fetal death. There is also cord cause. There is the one that the cord can cause. One, if there is very tight cord around the neck of that baby. The last woman I delivered, I had about 4.7 kg baby that has already macerated that helped to deliver. The cord was very, very firmly tied around the neck of that child up to 3 times, and there is no how the baby is going to survive this. So if there is tight cord around the neck, if there is cord knots, this is a situation whereby the cord will be tied up to 2 or 3 places. It reduces the amount of oxygen the baby received, and this can kill the child. And again, if there is cord prolapse, these are the things that can occur in the uterus that can lead to the death of the baby. Another thing that can also lead to the death of the baby that is being contributed on the part of the baby is if that child has fetal defect, like if there is any abnormality of any sort, especially the ones that involve the heart, this can lead to the death of that child. Or if that child is having an infection, especially the ones he or she contacted from the mother in the uterus, it can kill that child. Then another thing that can also affect the child unknowingly to the mother is not paying rapt attention to your body movements. If you're having severe abdominal pain, especially when you know that your EDD is very far, if you're having fever in pregnancy, if you're having vaginal delivery in vaginal bleeding in pregnancy, please always contact your healthcare provider. The earlier the better. Although there are some that the cause is unknown, but if you're able to prevent those ones that can be prevented, it's going to go a long way in preventing the death of the child in uterus after 9 months journey. The reason I'm making this video is because it's disheartening for a woman to carry. There are some that will not even notice that the baby is already dead, and they'll be carrying a dead baby. The last delivery I had, the woman came into labor. In short, she went to the hospital the day before that day, and doctor advised her that she's going to go to cesarean section because of the weight of the baby. She said let her go and discuss with her husband. Then the following day, she came in labor. When I checked the fetal heart, I could not get the fetal heart. We had to carry out an ultrasound scan, and after that, we couldn't even get the fetal heartbeat. So then after the delivery, we found out that the baby did not just die, but baby has macerated. Because I was asking her, when I was unable to find the heartbeat of that child, I was asking her, are you even feeling the movement of this child? She says sometimes she feels it, sometimes she doesn't. Please, it is a must you feel the movement of that child. If you are not feeling it, please tap your baby. A gentle tap is enough. If that baby is there, baby will make a move. That movement is enough to tell you that your baby is fine. If you are carrying an active baby and suddenly baby is not more active, the movement has slowed down, please visit the hospital. That's why it is advised to start your antenatal on time. Start your antenatal on time. If you register on time, all these measures can be, all these complications can be prevented, because if you're able to detect it on time, you will have things to do in order to prevent it from occurring. If you're having high blood pressure and you are not aware, then you might take in and carry your pregnancy up to 6 months before you even notice that you're having high blood pressure. Before that, the deed must have been done. In my last shift, a woman came in a hospital. She's not our patient anyway, but when she came in with fits. She already having an eclampsia, and she had 6 months pregnancy that baby had died in the womb and macerated. She was unconscious, but this would have been prevented if she registered on time and they are able to notice that she's having high blood pressure. Please, if you're a mother and you're pregnant, if there is anything that needs to be done, do it. So at the end of 9 months, what matters is that you are safe and your baby is safe. Thank you so much if you watched this far, and please share so that people that need it will also watch the video and again pick one or two things. Subscribe, and again always check to know when I have posted in a new video. Thank you and goodbye.